Assalamualaikum warahmatullahi wabarakatuh. Izin memperkenalkan diri, nama saya Syifa Samsara Feri sebagai peserta oral presentation with FK Unjani tahun 2021. Izin memaparkan hasil literatur review yang berjudul The Difference in Intelligence Quotient Between Stunting and Non-Stunting Children. For the introduction, in 2017, around 22% of children under 5 in the world were stunted. Early stunting has the potential to interfere with neuroplasticity, maximal development in the prenatal period, and the first 1 year of life. Impaired neuroplasticity is the impaired intelligence and cognitive development in the future. For the next introduction is children with early onset persistent stunting, age 1 until 6 months, is settled for the up to 60 months, have a low intelligence score. So the relationship between stunting and child IQ score is early onset persistent stunting negatively correlates with the children's cognitive abilities based on et al. 2019. Based Berkman et al. Stunting at 24 months of age is associated with IQ score of age 9 in Peru and 8 and 11 years in Philippines. Based Das et al., stunting predict future cognitive school progressivity or both. Based Kindergarten et al., children with the high and head circumference in the first 5 years of normal life have a higher IQ score. For the method, for the research subject, for the inclusion is literature on the IQ difference between stunted and non-stunted children. For the exclusion is source published over 10 years. For the research design, descriptive with a deductive approach. For the sample is the theoretical sampling. For the research variable and in the independent stunting, for the dependent is intelligence quotient. For the material and instrument using software, journals, and books. For the result, the relationship between stunting and children's IQ, the IQ score of stunted children is different from that of non-stunting. Based Gunasari et al., Aurora et al., Sanjaya et al., Lee et al., and Pradita et al. And the second opinion is there was no significant difference between the IQ score of stunting and non-stunting children based on Akui et al. And Unisasari et al. For the effect of stunting on children's cognitive development, the first opinion is the cognitive development of stunted children is different from the non-stunted, based on Gashu et al., Das et al., Yadika et al., Lubis and Sartika, and Nasar et al. For the second opinion, stunting does not affect children's cognitive development, based Crookstone et al. For the next result, the relationship between stunting and children learning achievement in school, the only opinion is stunting significantly affect children's learning achievement, based on Piccoli and Toy and Nadirawati et al. For the effect of early childhood stunting on children's cognitive development, the first opinion is stunting result in permanent impairment of cognitive development, based on Yadika et al. And the second opinion is early stunted children who catch up with growth have a cognitive development that is no different from non-stunted, based on Crookstone et al. And Lubis and Sartika. So the conclusion is, first, stunting affects a children's IQ score, cognitive development, and learning achievement. Second, the IQ score of stunted and non-stunted children differ significantly. And the third, the degree of stunting severity affects the IQ score of the child. Fourth, early stunting affects children's intelligence and cognitive development. 5. Early stunting children who successfully recover from their stunting status or catch up with growth have the same cognitive score as non-stunting. And the last factor thought to influence stunting is inadequate protein intake, micronutrients, length of breastfeeding, socioeconomic status, height and birth weight, infectious disease, and prenatal education. Sekian presentasi dari saya, kurang lebihnya mohon maaf. Terima kasih.